enzyme cascade theory, cascade means over here where there is enzyme cascade theory, where cascade over here means that it is going to be interlinked reaction. Okay, there are many clotting factors, एक के बाद एक दूसरे का फॉर्मेशन होता है, और जब एक के बाद एक दूसरे का फॉर्मेशन होता है तब जाके ये पूरा प्रोसेस जो होता है वो कंप्लीट हो जाता है. So let us discuss this theory where the injured tissue releases thromboplastin, okay, and the platelets release platelet thromboplastin or platelet factor 3. Don't need to remember it as exo or endo. You please remember it as injured tissue releases thromboplastin and releases thromboplastin or platelet factor 3, which in the presence of calcium and proteins results in the formation of an enzyme called thrombokinase, prothrombokinase. This prothrombokinase, सबसे पहले it will neutralize heparin. As you know, heparin is an anticoagulant. So हमको उस जगह पे चाहिए blood clotting, इसलिए it will neutralize heparin. Your liver has produced a protein which is called as prothrombin in the presence of vitamin K. Prothrombin gets converted to thrombin in the presence of prothrombokinase. Thrombin converts fibrinogen into fibrin, and you will see that everywhere you require calcium ions. Now, this fibrin, if you pay attention over here, this is your artery which had ruptured. Now, this fibrin will form a mesh at that injury, and that will trap the RBCs, resulting in the formation of a clot, which is called thrombus. So, that total around 13 clotting factors, out of which clotting factor 6 is hypothetical, and vitamin K is not directly involved, but it is required for the formation of thrombin in the liver. So with the red blood cells, now let us continue with the blood grouping concept. And we are following the ABO system of blood grouping. So before that, do remember that on the red blood cells, there are certain proteins which are called as antigens. And these are not self antigens. These are antigens for those human beings who don't have them on their red blood cells. So if I am having antigen A on my red blood cell, my blood group is A. So it is not a self antigen. It is going to be an antigen for a person with blood group B, because that particular person will not have this antigen. He will have a different antigen called as antigen B. So there are four blood groups: A, B, AB, and O. And if the person has blood group A, the antigen on the red blood cell is A. B antigen is B. The person with blood group AB has both the antigens A and B. It's a classical case of codominance. A person who does not have antigen A or B on the red blood cell has blood group O. Now, when a person has blood group A, he will not produce antibody A, but he can produce antibodies B. Whereas a person with blood group B can produce antibody A. As the person has blood group AB, he has bought both the antigens, so he'll consider these two antigens as self. So he'll not produce any antibodies against A and B. So the number of antibodies in the plasma will be nil for A and B. Then the person with blood group O, on the antigens, there is neither A nor B antigen on the red blood cell. So such a person will produce both the antibodies, A as well as B. Okay. So that is why we say that a person with blood group A can donate it to A, but he cannot donate it to B. He can donate it to AB, but not to So overall, as you know from our lectures, that the blood group AB is a universal recipient and the blood group O is a universal donor. More precisely, O positive, I'm sorry, O O negative is the universal donor and AB positive is a universal acceptor. So what is this positive and negative? It is based upon another antigen on the red blood cell, which is called as the Rh antigen, which was discovered in rhesus monkey. The same antigen is also found on human red blood cells. So if the Rh antigen is present, the blood group is considered to be Rh positive. If it is not there, the blood group is considered as Rh negative. So you got two blood groups, positive and negative. Remember that Rh negative person can give blood to Rh positive, but Rh positive cannot give it to Rh negative. Rh negative will produce antibodies against Rh positive. So if the male is Rh positive and the female is Rh negative, as the Rh positive is an allele that is present, it is going to be the dominant allele. And the first pregnancy, the offspring is going to be an Rh positive offspring. So अगर मेल RH पॉजिटिव है और फीमेल RH नेगेटिव है, ऑफस्प्रिंग भी RH पॉजिटिव होगा. So now what will happen is, during the first pregnancy, what will happen during the first pregnancy? There is going to be a tissue called as the placenta, the organ that is placenta. And due to placenta, there is no mixing of the fetal and the maternal blood. Okay? As a result of which, the mother's immune system does not know that the baby who is developing is RH positive. इसीलिए फर्स्ट प्रेगनेंसी काफी सेफ होती है, क्योंकि यहाँ पे मम्मी की इम्यून सिस्टम को पता ही नहीं है कि द बेबी दैट इज डेवलपिंग इन हर इज आरएच पॉजिटिव. But at the time of parturition, at the time of childbirth, during the delivery of the child, the placenta breaks. At that time, some of the fetal blood comes in contact with the maternal blood, resulting in the formation of antibodies against Rh positive antigens. And now the mother becomes sensitized. That is, her blood will show the presence of antibodies against Rh positive antigen. But first baby का कोई टेंशन नहीं, because the baby is already delivered, the baby is out, and the mother has produced the antibodies in the blood. During the second pregnancy, once again the father is Rh positive, the mother is Rh negative. The second child is also Rh positive. Once again, the mother immune system doesn't know that the baby is Rh positive. But still, from the last pregnancy, the antibodies that she had produced will pass through the placenta and then attack the RBCs of the fetus. As a result of which, there will be clumping of the red blood cells of the fetus, and that is called erythroblastosis fetalis or hemolytic disease of the newborn, HDN. And if it's a severe allergic reaction, it can result in the death of the fetus, or else the child will be born with a low red blood cell count, anemia, severe jaundice, and fever. So the complications arise not at the time of first pregnancy, but at the time of the second pregnancy. And the child suffers from a condition called erythroblastosis fetalis. But do not fear, there is medical science. And after the first pregnancy, the doctor will give an injection which is called Coombs serum. It will have antibodies against the RH positive antibodies produced by the mother. So फर्स्ट प्रेगनेंसी के पास बाद मम्मी ने जितनी भी एंटीबॉडीज बनाई हैं, ये हमारा जो इंजेक्शन है उन सारी एंटीबॉडीज को न्यूट्रलाइज कर देगी. तो सेकेंड प्रेगनेंसी के टाइम पे जो मदर सेंसिटाइज थी, उसके बाद वो एंटीबॉडीज नहीं है जो प्लासेंटा के पास होके उस फीटस के रेड ब्लड सेल्स को अटैक कर सके. सो दैट इज हाउ the second pregnancy complications will be avoided by giving antibodies against Rh positive antibodies. Okay, so we'll neutralize all the antibodies produced by the mother.